Okay, good evening, everyone. And before starting the session, I would like to introduce myself a little. This is Nandita. I done my master's in nutrition and dietetics, and I am carrying around a decade of experience as a dietitian and nutritionist. I'm yoga instructor too. Okay, I did 200 hours yoga and prenatal, postnatal. I did phase yoga and all, and yoga therapy also I did. And this course, it duration from 1 month. Okay, and please introduce yourself in the comment box from where you are, your name, and why did you join this course, and the qualification you are carrying, and why did you join this course, everything. Please introduce yourself. Everyone, please introduce yourself. So this is 1 month Ayurvedic diet and nutrition dietetics course. Where you can learn a lot of information about food and nutrition, disease management, and we are going to learn the basics, from the basics nutrition to advanced level. Okay, so what kind of diet we are going to provide for the diabetic condition, for hormonal imbalances, for infertility, and nowadays, many people are suffering from different type of lifestyle disorders and metabolic disorders. Why these cases are increasing nowadays? What is the root cause of any disease? Okay, how we can prevent from the disease condition? What kind of diet we have to include? So what is the link between the nutrients and the disease? Okay, these all we are going to learn in this course. So along with this, you are going to get all the PDFs and material, study material also. So end of the course or middle of the course, I'm going to recommend few books which is available online. You should buy for more knowledge. Okay. So here from basics to advanced, like this course contains basic what is the nutrition, what is the dietetics, and nutrient, micronutrient important in disease prevention, macronutrients, the difference between macro and micronutrients. Okay, and gut. Nowadays, if you observe, many people are suffering from gut issues. Because of the leaky gut only, we are getting 90% of the diseases. How we can prevent from the leaky gut, how we can reboot our leaky gut, everything in this course we are going to learn. Okay, you don't need to worry. So while learning, if you get any queries regarding the course, regarding the subject, you always are welcome to ask. Okay. Sharat Ram. Hi, Sharat sir, Maldives wellness specialist. Thank you, sir. Thank you for joining this course. And Saroj Agarwal, wellness specialist means, sir, why did you join this course? Oh, generally I'm asking. Okay, Saroj Agarwal from Odisha regarding diet and nutrition. That's very nice. So if any one of you are from scientific background, science background, Tiruchelvi from Malaysia homemaker. Hi, ma'am. Sridevi, Andhra Pradesh yoga trainer. Hi, Sridevi garu. Namaste.
Namaste, ma'am.
Namaste. I'm also from Telugu state. That's why.
Oh, my God. Yeah, nice, ma'am. Yeah.
Lata Krishna Prasad Manipal. Hi, ma'am. Garima Sakya, Agra, Uttar Pradesh. As a nutritionist. Nutritionist means, Garima ji, what you did? Did you
Uh,
any nutrition course or
yeah,
masters?
ma'am, actually, I have done holistic approach of a nutrition course from VLCC, and I just
Okay.
want to learn about Ayurvedic science, so I joined this course.
Okay. And Ilakiyavati, Hyderabad. I have also done more with self-knowledge. Okay.
Hello,
Ma'am.
namaste, good evening.
Good evening, sir. Namaste.
Myself, Dr. Biswajit Das, physician.
Okay, sir. Nice meeting you.
Thank
You're
you
from,
very
sir,
much.
which place?
I am from West Bengal, Asansol.
Okay. I'm
So I'm
from
very much
Andhra
interested
Pradesh.
regarding this course. Basically, lots of even all diseases are related with definitely
Nutrition.
diet. Yes, diet,
Yes.
their nutritions, micronutrients, minerals, and everything is all depends on the food. And I definitely I like to actually correlate with five elements, that is air, space, air, water, and all diseases are caused by the either deficiency or excess amount. So
Yes, sir.
yeah, so that's why I'm very much interested to learn from you to understand the deep things for nutrition
So
and
much, sir, for joining this course. I worked with the hospitals as a dietitian.
right.
Now I working for Amazon as a
Hmm.
part-time only as a dietitian.
Oh,
And
nice.
yeah, I'm a yoga instructor now, so I wanted to start my own. So as a freelancer, I'm doing now. Just
Yeah.
I wanted to treat therapeutic.
Hand mudras. That is also other than my allopathic practice. I like it.
Okay, thank you, thank you so much, sir. And this course, you are going to learn the basics from basics to advanced level of the nutrition. A
Right.
completely
Right.
diet, what are the nutrients, and to prevent the disease condition. And we will teach particular yoga asanas, yoga mudras, pranayama, breathing technique also to treat particular
Yes.
condition. Because this course completely we are combining nutrition with the yoga
Yeah. Yeah. Yeah.
and
Eh,
naturopathy and allopathy. All allopathy also part of this.
Mm. Life expectancy, in fact, is depends upon the breathing. Everything
Yes,
that
sir.
is the
Yes. Yes.
Kriya Yoga is a very definite and very scientific. In fact, anybody can explain it by quantum physics also. That how we inhale or exhale our air as a oxygen and to convert it into our life, that is prana.
Yes, sir. So we require five elements. So air also one of the element. So how we are breathing, how we are inhaling, exhaling, it expands our prana. So that is
Yeah.
the benefit of practicing prana. And many people are not breathing it in the right way. That's why
Yeah.
we are blockages happening. We are getting
Most of the
disease.
people, they don't know how scientifically it inhale or exhale. That is, I
Yes,
think,
yes.
more than 80% people don't know how to inhale or exhale. That is the main thing.
Yes, sir. Yeah. Many people even they're not even focusing. They are
Yeah.
not interested to do this also.
Mm.
That is the main problem. And as a physician, you know that how this leaky gut leading to many disorders.
Yeah.
So how can we can reboot our gut health, and we learn with the new researchers as we are going to explain everything. So what new researchers are saying about the gut and what modifications we have to do to improve our gut health and all. So
Right.
I think this course will be helpful for everyone because this Subha Yoga Foundation main intention is providing the quality of the knowledge,
Yeah.
and 70% of the population worldwide suffering from nutritional deficiency only. And
Definitely. Definitely.
so many people don't know and how much they have to eat, what they have to eat, how much they have to eat, and disease if they wanted to maintain their overall body weight, or else they wanted to prevent from the disease condition. And especially if anyone practicing in the hospitals or anyone working for the gym as a trainers or anyone practicing yoga, this course would be
Right.
more helpful. Because
Right.
what I observed, many yoga teachers are excellent in their knowledge, but many people have no idea the diet part. So
Yeah.
what diet we have to give to prevent from the diseased
Yeah. Yeah.
conditions.
In
Yeah.
that, in this regards, one thing what I have observed in the field, that iron deficiency is a very common problem, But you see, it is not only for the younger girls, but adult males are also suffering from nutritional deficiency due to that is the iron deficiency anemia, which is in fact, if it is less, it may causes our metabolism disrupt. In that situation, anybody can suffering from diabetes in a long, if their iron level for ferric form is low. Basically, that is lack of awareness, you can say.
Yes, sir. Because of lack of awareness only.
Mm.
And yeah, many people are today, nowadays, nutritional deficiency increasing because of lack of knowledge. No knowledge about this, and many people are experts in yoga, especially, and doctors
Yeah,
are also experts in medicine. But combining food with the medicine would be more beneficial.
and that is very important. Not only medicine or a molecule that never cure a patient. Huh?
Yeah.
Only different types of molecules and different types of allopathic drugs, it never cure. Mm.
Yes, sir. Yeah,
Mm.
absolutely.
Anyway, this time I want to learn from you. Thank you so much.
Thank you, and teach me more about allopathy. If I like, if I say anything wrong
No,
about the medicines,
not
please
like that.
correct me.
We interact definitely.
Sure, sir. Thank you so much.
Thank you.
And Dr. Sastri Jaishwal, Madhya Pradesh, physiotherapist. Hi, ma'am. And to guide people toward a healthier, happier life. Okay, nice. Preeti Sharma ji, namaste. Yoga teacher and nutritionist. Nutritionist means ji. Have you
Ma'am,
done any?
ma'am, I'm a British Upadhyay. My name is,
Okay.
I'm dietitian and a yoga trainer. Now I'm presently working from a yoga teacher as the online.
Dietitian means what you have you done your
Uh,
masters?
मैम एक्चुअली आई हैव अ लॉन्ग टाइम एक्चुअली बहुत डिस्टेंस हो गया है जो डाइटिशियन का मैंने आई हैव लर्न एमएससी न्यूट्रिशन एंड आई
Okay,
वर्क
okay.
एज अ हॉस्पिटल एज अ डाइटिशियन
Okay, good, good. Nice meetings. I'm also dietitian.
and I have interested Ayurvedic nutrition.
Okay. Acha. So, what exactly you want to learn about Ayurvedic? So, in this
Uh,
course, we are going to, cover the basics of Ayurvedic principles. What is Vata, Pitta,
no,
Kapha?
I'm only I'm only Ayurvedic diet.
Okay.
Ayurvedic diet knowledge.
Acha, okay. Ma'am, Ayurvedic diet means we are going to add only spices with scientific evidence, okay? And in this course, we are going to explain the types of dosas. And accordingly, those are what kind of foods we have to include to prevent from the diseased condition, and how spices and that Ayurvedic helps helping us to prevent from the diseased condition. That alone not sufficient. Along with that, I'm going to teach the modern dietitian course also, along with scientific evidence. Okay, so both are very important to learn more about this, because if a person's suffering from Ayurveda, if for example, the one patient, if he's following Ayurvedic medicine, if he's following Ayurvedic medicine or allopathy or Unani medicine, whatever medicine he's following, definitely he has to do some food restrictions. That's why there is no much food restrictions according to Ayurveda and modern medicine also. Food restrictions in Ayurveda and in modern medicine, so both food restrictions are same. Food including also same. So how it help us to prevent, how it is helping us from the diseased condition, that we are going to learn more in this course. Okay. If anyone have doubts regarding the course, please ask me now. Any doubts regarding course and syllabus, any study materials, and how this course going to help you for your career? How many of you are working as a yoga teachers? Please mention in the comment box or raise your hand.
Subsequently, we know what are the things, as you told, different types of dasas, and how it modify our diets and everything. So subsequently,
Yes.
we
No, yes, sir.
learn from you. Okay.
Syllabus I will share in the group. I think Raju sir, I think he has said in the group about the syllabus. Okay. Okay, 1 minute. Let me check. Again, I will explain the syllabus, what we are going to cover in this course. Okay. 1 minute. One minute, I will checking the syllabus. Okay. In this course, we are going to cover introduction of food and nutrition today class and basic principles of Ayurveda. So what is Ayurveda? What is the type of Ayurveda? The doshas we are going to learn in this course, and basic principles of naturopathy and herbals. This particular topic I will explain end of the course, in the end of the course. Okay, naturopathy and herbals with scientific evidence. Okay. Yeah, you will get class recordings every day, no issues. And macronutrients. So, what is macronutrients? What is the difference between macro and micronutrients? What nutrients are very important in disease prevention? And we have macronutrients and micronutrients. Both plays very important role in disease prevention and body's function. Okay. So, what is the difference between them? How much we require? That is also we are going to learn in this course. Okay, macronutrients, micronutrients, and trace minerals. Okay, calcium, magnesium, how it is helpful, that is also we are going to learn. And fiber. So many people are not taking sufficient amount of fiber, that's why it leading to constipation. For few people, they are suffering from piles also, that's because of lack of fiber. And many obesity people also not consuming good amount of fiber, it leads to constipation, and it's very difficult to lose the weight if you are not taking good amount of fiber every day. So fiber is very important nutrient for the gut health and for the weight management, and to prevent from the constipation, for proper bowel movement, for everything fiber also very important. Many people ignores fiber, intake of fiber. So how much quantity we require? The quantity of the fiber for adults it is different, for childs that is different. So according to age, how much we have to consume. In therapeutic condition, like if a person suffering from in constipation, how much fiber they require and from where we are getting fiber, this is also we are going to learn in detail. Okay. And water intake, I think many people don't consume sufficient amount of water. So if you are not drinking good amount of water, it leads to dehydration. Okay. For proper organ function and to eliminate wastage from the body, and to improve our body temperature, to maintain our body temperature, to prevent from the migraines, for everything water is very important. So how much water is required for person? Because the water intake is different from person to person based on their weight. Okay. So this is also we are going to learn, because many people know what they do. Early morning, they drink a lot of water. Few people drink at least 1 liter of water, which cause gastric. And few people, if they are consuming 1 liter of water on empty stomach, it may lead to bloating also. So 1 liter of water consuming on empty stomach is not ideal for everyone. So we don't require 1 liter of water after waking up. Okay. So many, misleading. So misinformation is going on social media. Many people following that. So here, no, we are going to learn that also. So how many liters of water we require per day? So for kidney patients, for liver, so depend on the diseased condition, we are going to learn. Okay. And after this section, I will share again the syllabus with you in the group. And fiber, water, and what is carbohydrate metabolism, protein metabolism, fat metabolism, we are going to learn in this course, and fats and disorders of nutrition. So fats also very important. Few people considering fat as a poison, but that is lie. Okay, that is not a fact, because fat is very important nutrient. If you are not consuming good amount of fat, healthy fats in your diet, it leads to many skin related issues. And fat is very important for different type of nutrient absorption also. So how much fat we require, so what type of fats we have to add in the diet, and how we can control our cholesterol levels by adding fats, this is also we are going to learn in detail, because many people are getting confused while consuming the fat. And few people they don't consume fat at all, because they think that by consuming fat they're gaining weight, but that is not a fact. Because fat is very important. If we are not consuming good amount of fats in our diet, it leads to nutrient malabsorption. So that is also very important. So how much fat we have to consume for weight management, the fat intake is different. For particular diseased condition, the fat intake is different. So we are going to learn. So how this course is going to helpful for you. For example, if you are a yoga trainer, if you are getting any PCOD patient, okay, nowadays out of 10, 6 or 7 women suffering from PCOS and PCOD, because of lifestyle changes, because of the sleeping sleeping habits and all. So many people are nowadays suffering from hormonal imbalance. So whenever you are teaching yoga, so whenever you are giving treatment, you are going to you are going to teach only asanas. So whenever you are teaching asanas, it definitely very helpful for them, to improve the oxygen levels to the uterus, to the ovaries and all. If you are not adding diet along with the yoga, you can't see 100% result in the patient. Sorry, in the client. Okay. If you want 100% result in the client, along with the whatever, like along with the yoga asanas, or along with whatever you are giving now, along with that, adding a diet is very important. Without diet, we can't see 100% result, and that client also can't get good result. And it's very difficult to lose the weight or gain the weight or prevent the disease without any nutritional support. Okay, so to prevent from any disease condition, for weight management, and to improve our lifespan, and to improve energy levels, for positive thinking, for positive life, for everything, nutrition is very important. Okay, 80% of the diseases nowadays people are facing because of the nutritional deficiency. So if your gut health is not good, whatever you're eating, if it is not absorbing in proper way, it leads to diseased condition. Okay, as a yoga teacher, or as any health coach, we should know the basics of nutrition. This is very important. Okay, it is very helpful for you to treat your clients 100% in holistic approach. Minute. Fat and disorders of nutrition, food sanitation and hygiene. That is also very important. In this course, we are going to learn about food sanitation and hygiene, and what type of vessels we have to use while cooking. Many people using non-stick, which cause cancer. So which utensils help us to prevent from the nutrient loss? That is also very important to know as a nutritionist. So that is also we are going to cover in this course. Okay. And BMI, body mass index. If you don't know how to calculate BMI, it's very difficult to make a diet plan. Okay, BMI is very important. BMR is also very important, basal metabolic rate. According to BMR only, we are going to provide the calories to the particular person. Okay, and recommended dietary allowances, RDA. So these RDA values we have to follow, because according to National Institute of Nutrition only, we have to follow the RDA values. We are getting RDA values by National Institute of Nutrition only. Okay, I will share this PDF with you in the group. Recommended dietary allowances, because this nutrient requirement is different from person to person. The nutrient requirement different from male and female. For children, the nutrient requirement is different, and for adolescents, the nutrient requirement is different because according to their growth, according to their age, their metabolism, every different type of nutrients. That's why we are going to learn RDA values also in this course. Okay. And I'll explain PCOS, PCOD. This is, if you learn the diet plan about PCOS and PCOD, you can get 100% result. If you're getting any clients, if the person suffering from infertility or PCOS, PCOD, without diet, it's very difficult to treat them 100%. Okay. So we are going to learn PCOS and PCOD. And sports nutrition. How many of you know about sports nutrition?
Yes, ma'am.
Yeah, so sports nutrition also one day we can discuss about sports nutrition because this is very important topic what I believe. Many those who are going for the sport, you are athletes and many people do weightlifting and all. Okay, gym freakers and all. So no, they are following. Most of them are following very wrong diet. Excess intake of protein or less amount of carbohydrate, so which leads to cardiovascular diseases. This is also we are going to learn. Okay. 1 minute. I'm sorry. And diet plan for various diseases, weight loss. And have you observed any weight loss diets online? So few people are promising that 10 kg weight loss possible in a month. And we will help you to lose the weight 15 kgs in a month.
That
You
is
know?
fake, ma'am.
Yes, sir.
Because
That is,
if we vigorous, tortured your body, negative effect will be there. It is not the
yeah.
right way. Gradually only we can incline.
Yeah, but they're charging 1,000 of rupees for one diet plan where they're, they're suffering from gallbladder stones and any organ failure after following the diet. So in this course, we are going to learn how to manage our body weight in a healthy way. You don't need to start starving yourself. You don't need to, control your emotions and all while eating. How much we have to eat, what we have to eat to control our appetite, and how easily we can lose the weight in a healthy way. We are going to learn in this course. Okay. Weight loss, weight gain. This is also very important. And many people are nowadays concerned about their weight management. They wanted to lose weight in a month without, like, in a magical way. So if they're 100, for example, a person is 100 kg weight, body weight, if they wanted to lose weight in a month 20 or 30 kgs, they wanted to reduce weight in a magical way, which is not possible. So how many kgs are healthy? So in a healthy way, how many kgs we can reduce in a month? That we are going to learn in detail. Okay, weight management also very, very important for hormonal balance and for arthritis, to prevent from arthritis, to prevent from cholesterol, to prevent from cardiovascular disorders. Okay, because obesity is the way to many diseases. Obesity is not a disease, it leads to many diseases. So obesity management also very important. And always remember, we can't reduce more weight in a month. If you're reducing more than 10 kgs in a month, definitely you have to see the doctor. So if you go to the doctor and if you're reducing 10 kgs of weight in a month, and if you're visiting the doctor, definitely doctor will guide you, will suggest you many tests. So what happened? She lost 10 kgs in a month. So that is not a healthy way. Okay. In healthy also we can lose the weight. Only we can lose the fat, not the muscle. There is a lot of difference between losing the weight, losing the fat, and losing the muscle. there is a lot of difference between them. Okay, so in this course we are going to learn that also in detail. And thyroid, many people nowadays suffering from thyroid, and thyroid also leads to weight gain. It leads to infertility in some cases, and it leads to hormonal imbalance. So how to manage our thyroid problem, that is also we are going to learn. And diabetes, so most of the population nowadays suffering from diabetes. So we are going to learn types of diabetes, and during pregnancy, gestational diabetes, and how we can prevent diabetes. So for diabetes, what type of diet we have to follow, that is also we are going to learn in detail. Okay, acidity. So if any person having acidity problem, it's very difficult to absorb all the nutrients in the body. Okay, it's very difficult to absorb all the nutrients. That's why acidity, how to manage acidic condition also, that is also very important, where we will be learning in this course. And heart diseases like cardiovascular diseases and all, fatty liver, allergies, anemia, cancer, and a special diets for pregnant and lactation mothers, special diets for adolescents, special diets for kids. This is also we are going to learn in this course. Okay, cholesterol diet, and hypertension, joint pains, skin diseases, and we are going to learn about the GERTAs. So we will start with the basics. Okay, and little bit therapeutic also we are going to learn in this course. Though this is I will share with you the PDF in the group. So this is the topics we will be covering in this course. So menopause also will be covering. And I will give you assignments in the course also. After every class, I will give you the assignments. Please try to do that assignments for more knowledge. If you're not doing any assignments, it's very difficult to learn, because this is only 1 month course, and nutrition is a very huge subject. You can't learn everything in a month. So if you're doing assignments on the time, if you attend regularly, you can gain more knowledge. Okay. And any doubts? Yes, hypothyroid also we are going to, learn about hypothyroid and difference between hypo. Where is she? Harini ji, please mute yourself. 1 minute. Harini ji, how can I mute her? Okay, any other doubts?
Ma'am, we will get recordings also, no?
Yes, sir. You will get recordings, study materials, PDFs, few PDFs. I will share whatever PDFs I have. Okay, and remaining I will refer few books. It's for better knowledge. You can buy end of the session. Okay, end of the course.
Okay.
You can buy that also, and you better to maintain in one notes while explaining, because this I'm presenting in a PPT forms. So I'm adding many points while explaining. I add little more points also, which is not mentioned in the PPT. So better to write down for more knowledge. Okay. Okay. Any other doubts? No, right? Okay. So today I will explain about the macro and micronutrients. So what is macronutrient? This is basics of nutrition. what is macro and micronutrients. Before learning about doshas, we better to know about macro and micronutrients, the importance of these nutrients for our body's function. Okay, so what is macronutrients? So macronutrients are basically this food are divided into two parts, macro and micro. Now let's discuss about macronutrients. Okay, carbohydrates, proteins, fats are micronutrients. So anyone knows what is carbohydrates? Anyone knows about carbohydrates? What is carbohydrates? Why we require carbohydrates?
Ma'am, carbohydrates are energy giving
It's
foods.
the fuel for our body, ma'am.
Yes,
Oh.
sir. Yeah, yes, ma'am. Thank you. So carbohydrates. To sit, to talk, to walk, to sleep, whatever we do, we require energy. Okay. So those energy we are getting from the carbohydrates. Okay. Without carbohydrates, we don't get proper energy. So that's why it considered as a macronutrient. So we require carbohydrates in larger dosages compared to vitamins and minerals. Okay. Carbohydrates provides it gives energy, it provides fuel. Energy works as a fuel. Okay. So carbohydrates are very important. So what kind of carbohydrates are we are including in the diet, that matters. Okay. And proteins. So how many of you know proteins, about the proteins, the role of proteins? So now we know that carbohydrates are energy giving, and this is very important to do any work because we require energy to do anything. Okay, so carbohydrates, that is the role of carbohydrates in our body. Now let's discuss about proteins. So proteins are very important nutrient. Without proteins, it's very difficult to build our muscles, not only muscles. Proteins are a very vital nutrient because for beauty purpose, for health purpose, to balance hormones, for antibodies in the body, and to balance hormones, to produce few hormones, and to improve our heart health, muscle, and to improve our the hair. For everything, proteins are very important. And nowadays India is in the world, India suffering from protein deficiency. It leading in second position. Many Indians are suffering from protein deficiency, and if we are suffering from protein deficiency, it leads to weakness. It's very difficult to feel energetic. Okay, carbohydrate for the energy purpose, proteins for the strength. Okay, for the strength, for bodybuilding, and for cell repairs, to regenerate new red blood cells. Okay, and if any person suffering from anemia, protein also one of the reason. Anemia, iron plus protein deficiency, and few vitamins like vitamin B12 deficiency also leads to anemia. There are many reasons for anemic. Okay, so protein also one of the reason. And any women suffering from, or many men suffering from low sperm count, if any women suffering from infertility, protein also one of the reason. And for good fertility rate, and for muscular body, and for to build the muscles, for cell repair, for everything we require protein. Without protein, it's very difficult to prevent from the diseased condition. So that's why it considered as a macro. We require protein in larger amount compared to micro and micro minerals. Okay, micronutrients. Now you understood, right, the importance of carbohydrates and the importance of proteins. Okay, these are very important nutrients. I will explain how much percentage we have to include in the diet as on fats. Why fats are very important? For example, if you visit the doctor, or if you visit any dietitian or any health coach, if you're obese, definitely they will ask you to cut down fats. Okay. So why we should cut down fats? How much we have to cut down from the diet? how many grams of fats we have to include in our diet to manage weight and prevent from any disease condition and to control cholesterol levels. Okay, so that is also very important. Fats are very important. Fat is very important nutrient for vitamin absorption in our body. Not only that, for proper skin health, to prevent from particular skin related issues. Not only that, if you want to look younger for a long time, fats are very important, because whenever we are trying to lose weight or whenever we are getting age, by the age, our fat we start losing the fat, especially from the face. That's why, compared to our body, we can easily we can identify our age in our face. That's because of losing fat as we age. So how we can prevent that, and how we can prevent fat related disorders, that is also very important. Fats are very important topic, and that's why we require fats also in very good amount. That's why it's considered as a macronutrient. Okay, now we understood, right? Carbohydrates, proteins, and fats. Everyone?
Yes, ma'am.
Yeah, what is carbohydrates?
Energy giving food, ma'am.
Yeah, energy giving food. For everything, whatever we are doing, for everything we require carbohydrates. Okay, from 1 gram of carbohydrate, we are getting 4 kilocalories. 4 kilocalories. And proteins. Why proteins are important? It is a vital nutrient to do repair
For
the
muscle
body.
building, muscle
Yeah,
repair.
muscle building,
Rebuilding,
tissue
muscle
repair,
building.
yeah, tissue repair, hormonal balance, heart health, gut health, and hair strength. Okay, body strength, anti-aging. For everything we require proteins. Okay, and antibodies, it produces bodies, it produces few hormones in our body. To balance hormones also we require protein. So protein also macronutrient. And fats for vitamin absorption in our body, and for our inner organs also contains visceral fat. Okay, so to protect and that also we require fat. So if you're not taking good amount of fat in our diet, and if our body has very less amount of fat in our body, so we look older than our normal age, and in few particular people it may leads to cardiovascular diseases if they don't maintain good amount of fat in their body. And why I'm telling this, I have observed many people, those who are going to gym, they don't want fat in their body, not even visceral fat, and they want 1% of fat in their body or 2%, which is very dangerous. That's why knowing the fat importance also very important. Okay, and vitamins and minerals. Why vitamins are so? These three nutrients are macronutrients: carbohydrates, proteins, and fats. If you are including 1 gram of fat, it gives 9 kilocalories. Proteins, from 1 gram of protein, we are getting 4 kilocalories. Got it, right? So whatever we are eating food, from each and every food, we are getting energy. So from what food, from 1 gram of adding that particular food, how many calories we are getting, that is also very important.
Ma'am, can you please repeat it? 1 gram of carbohydrate.
1 gram of carbohydrate gives 4 kilocalories, sir. 4 kilocalories, 4
Four.
calories, okay? Just 4 calories. Proteins give 4 calories. Fat give 9 calories.
Oh.
Okay? So this
Okay.
is very important. How many calories we are getting from a particular nutrient, knowing that very important. Because while making the diet plan, this is only plays an important role. Okay? So carbohydrate, proteins, and fat. So for example, we already discussed it, right? Carbohydrates are important for proteins for the tissue repair and body building. If you're not consuming carbohydrates, if you're only eating proteins, it's very difficult to do metabolism in our body, absorb in our body. So carbohydrates, how much percentage we have to take? Proteins, how many grams we require per day? Fats, how many grams we require per day? That we will be discussing in this course. Okay. And vitamins and minerals support and protect, and for support and protect a cell development and functioning. Vitamins and minerals are very important. Do you know one thing? 70% of the diseases nowadays only happening because of the micronutrient deficiency. If we are not consuming good amount of vitamins and minerals, it leads to diseased condition. For example, everyone knows that if a person suffering from diabetes, we have to cut down few calories from the diet. But only rare people know that adding few micronutrients improves insulin function, improves pancreas function. Only few people only knows that. Okay, so including particular nutrients in our diet always help us to prevent from the disease. Okay, so vitamins and minerals we require very lesser amount compared to micronutrients, but unfortunately, through our diet, we are not getting that minor amount also. That minimal amount also, we are not getting from the food, because most of us using only polished food, okay, refined one, and most of the junk food, whatever available in India, that is completely unhealthy. It doesn't
Right.
many street food doesn't contains any nutrients. That is also leading vitamins and mineral deficiency, and few vitamins are very important in gut health and weight management also. So we are not getting, we require very lesser amount, but even that also we are not getting. So vitamins and minerals are, that is the importance of vitamins and minerals in our diet. Okay, and fiber, already I have explained, fiber is very important nutrient, okay, for proper bowel movement, to reduce prevent from the constipation, for the weight management, for diabetes and all. So fiber also very important. And water, how many liters of water we are drinking? So how many liters of water you are drinking generally? Any one of you, can you explain how many liters of water you are drinking?
2 liters.
Your weight, ma'am? Weight.
Ma'am, every
74.
20 kg, we have to use 1 liter.
Yes, sir. Thank you. Every 20 kg body weight require 1 liter of water, but this is different from person to person, because few people may suffer from water imbalance in their body.
Yes,
How so?
actually, what happens? This water is very important for body, but it depends upon definitely on the body weight, but the geographical condition, the environment, and
Yes, sir.
Their
and
activities also, sir, because
yes,
they are
calorie expenditure,
doing some physical work.
yes,
They require
calorie
more.
expenditure. But the main thing is, most of the people, they don't know how much to consume water. They
Yes, sir.
always think and that many liters of water we ingest is
Yeah.
very good for health. But it depends on your condition. If you
Condition,
drink
yes.
more water, it will cause, it hampers your that is kidney function.
Kidney function, yes, sir. That's why the water intake, how much we are drinking, that is also very important. Few people
Well,
they never drink water.
yeah. Maximum 3.5 to 4 liters in our warm condition. I mean, in India, definitely in our area, it is 9 months hot. So in that condition, it is in Haridwar or Uttarakhand and Himachal Pradesh, I think less amount of water are prescribed because they do not need. Anyway,
Yeah,
thank you.
thank you, sir. So the importance of water also very important. So how many liters of water we are drinking that, and what are macronutrients and micronutrients? So we discussed about carbohydrates, right? So from where we are getting these carbohydrates? From which food we are getting carbohydrates? Any one of you? Any cereals? Like any millets, whole wheat, whole grains, okay? That considered as a carbohydrate rich foods. any cereals, whole grains and all. Because compared to any other food sources, we are getting more carbohydrate from that particular food group. So adding cereals in our diet is very important for the carbohydrate purpose. Okay. And lipids. So from where we are getting lipids? From
So in
seeds,
Ayurveda,
nuts.
excuse me, in Ayurveda, as you know that our India is most of the parts are hot and humid. In that condition, for carbohydrate, we can take rice. Actually, in Bengal, Bihar, and Orissa, in this
Oh,
side,
yes.
we consume more and more rice, but it is not
Mm.
advisable to take anytime rice. I mean, in the 3 times or 2 times. Most of time, anybody can consume once in I mean in a day, like
Yes, sir. Yeah,
lunch,
but thing is, yeah, how many grams we are consuming per day?
right?
And yeah, completely polished rice is not recommended every 3 times because we are getting less micronutrients. So recently, National Institute of Nutrition has released one statement that most of the Indians consuming more carbohydrate, they're not
Right.
focusing on protein. They're not focused on protein because
According to Ayurveda, is there any clear-cut suggestion for taking this rice, particularly rice? I am actually sticking on this
yes, sir.
rice.
Sir, according to Ayurveda, if we are adding, that ghee on top of food, top of
Okay.
right, it reduces glycemic index
All
naturally.
right. It is
Yeah,
also in our, yeah.
yeah,
Yeah, yeah.
according to Ayurveda, and recently it proved also, scientifically also it proved that
Hmm.
adding ghee with the rice, it reduces, glycemic index from the food.
Okay.
So it doesn't spike glucose levels in our body.
Okay.
But yeah, that is also according to Ayurveda, and scientifically also it proved.
Scientifically, it is proven.
Yeah,
Actually,
scientifically.
Ayurveda is very, very scientifically proved. Nowadays, we understand all allopathic doctors, we understand basically all others, I mean, that is American or any European countries, those who were always stick on new and newer molecules. But our this Ayurveda is very much ancient. It is more than 5,000 years and purely scientific.
Yes. But unfortunately, sir, many the Ayurvedic formulas doesn't have scientific evidence. That's
Really.
why government is not officially releasing them into the market. That is the main problem. So whenever whenever we are discussing about the nutrition Ayurvedic, we require at least some scientific evidence, or else uh, it is not acceptable, I think. That's why adding scientific view is
Rice is
very
good, ma'am, but the thing is, most of the people are using the polished rice, white rice.
polishing rice, sir, and the
Ah,
quantity,
quantity
physical
also.
activity, physical activity, and our ancestors use it. They use it to eat more only whole grains.
Yes.
Now, whatever rice available, that is different. They used to eat more millets. For if you observe the south part, few parts they use it to eat, eat more jowar. Rice were not that popular 300
Yeah.
years before. So
One thing I
yeah,
remember that one type of rice, it contains, if you see the grains of rice, there is a reddish type of straight line, which is basically rich of riboflavin.
yes, sir. That is, red rice contains riboflavin.
Nowadays, the production of
Riboflavin.
that rice is below and below. So we
Okay.
are always go through that polished rice, which causes our pancreas geoparadise or anything.
Yeah,
Right.
yes, but people are habituated to had
Yeah.
that white rice, the taste and all. So
Mm.
if we say that don't eat rice, they are getting upset that we are
That's why the
habituated.
number of colon cancer and pancreatic
Yes, sir.
cancer all are rising day by day.
Because of the lack of fiber and excess
Right.
intake of carbohydrates. Yes.
Right. Thank you.
Yes, sir. Thank you. So micronutrients and carbohydrates, lipids. Lipids means fats. So the importance of fats: support cellular function and structure, regulate temperature, protect body organs, store energy in the body. So, for example, any one of us not having carbohydrate whole the day, our body utilizes that energy from the stored fat. Okay, so that's why fat also very important for particular nutrient absorption in our body. Also fat is very important. And proteins regulate cellular processes, support mechanical and structural function. It also provides energy, but we shouldn't depend on protein for the energy purpose. Okay, because for the energy purpose we have carbohydrates. We don't need to depend on the proteins, because the protein role is different in our body. Okay, proteins are important for the tissue repair, for body building, and for everything. So we shouldn't depend on the proteins. Okay, so this is a macronutrients and this is a micronutrients. Tomorrow I will continue this section. After this section, I will discuss about the basics of Ayurveda, the difference between the doshas and what foods include and all. So why I have started with this macro and micronutrients, because this is the basics. So nutrition means what? How many of you know about nutrition? What is nutrition? What is nutrition? How many of you know what is nutrition? What is the meaning of definition of nutrition? So nutrition is
It's a
your
total process of eating food, then digestion, then the
the
absorption of
food.
nutrients.
Yeah, the food for the body's function we are studying in the scientific approach, scientific way. Okay, food is very important. It's linked with our each and every cell in our body. So we are studying about the food in a scientific way.
Well, so
Okay.
actually, whatever we take,
Okay.
it should healthy and it is properly absorbed in our body and creates our all organs and system in such a way that all metabolic functions are in a right path. Basically, nutrition, this is in Ayurvedic sense. Anybody can say it is a part of that prana.
Yes, sir.
Yeah. For which we can all life processes are carried out by that particular things which we ingest. Or like this, I mean, there is a very elaborated terms.
Sorry, whatever you said, that is right only.
Yeah.
So
No,
yeah,
it's
we
not
are
like
To put it
everybody.
shortly, proper metabolism. That's it.
proper metabolism. The nutrition means we are we are studying each and every food in a scientific way, and in a scientific approach, and
Yeah,
how
So,
to
ma'am,
study each and every. Yes,
because
yes, ma'am.
trillions of cells in our body, and
Yeah,
that all cells needs oxygen.
energy. Yes,
Yes,
needs
that food
nutrition.
particles.
Ah,
Yeah,
yeah,
that
needs
nutrition.
nutrition,
Yeah.
and that
That
nutrition
is
we
the
are getting to the food.
that is the power to enhance our system for everything.
Yes, sir. Okay, thank you, sir. Any someone
Thank you.
asking something?
Yeah, in a very simple words we can say कि बॉडी जिससे हमारी बॉडी बढ़ती है, मैनेज होती है और फंक्शन करती है, दैट इज न्यूट्रिशन इन वेरी सिंपल वर्ड्स.
Okay. Yes, ma'am, that is also correct.
एकदम
But
एकदम आप
according to
बहुत
Ayurveda,
हाँ, राइट, बहुत बढ़िया। और ये भी मुझे कहना था कि आपने जो ये हिंदी में वार्तालाप जो शुरू किए हैं, दैट इज वेरी इम्पोर्टेंट। एक्चुअली क्या है, हम जब आयुर्वेद के बारे में बात करते हैं, ठीक है ना, जब हम आयुर्वेद के बारे में बात करते हैं, हम अपना भारतीय संस्कृति के बारे में भी बात करते हैं। तो ठीक है, ऐसा कुछ नहीं है, कुछ पीपल्स ऐसे भी होंगे जो हिंदी में उतना जानकारी नहीं है और हिंदी प्रॉपर टर्म्स नहीं यूज करते हैं, लेकिन जो भी हम यहाँ पर हूँ तो मैं हिंदी में भी वार्तालाप कर सकते हूँ कुछ कुछ चीजें। हम जो कि यू नो इंग्लिश इज नॉट आवर प्रोटीन एनर्जी। So we can speak, or we can talk, or we can communicate each other with Hindi also.
Rasa, Rakta, Mamsa,
Yeah.
Majja, all these things come in Shukra. The metabolic process one by one it's going to absorb all this.
Yes. Yeah,
But
even
many
if
people are from South also, na? They
yeah,
can't
yeah, yeah, yeah. Yes,
Hindi.
that I know. This is not the issue. No problem. Anybody can explain by English also. We can learn by Hindi also. If somebody in other languages also, like some Sanskrit terms, as Ayurveda, the basic is Sanskrit terms, and after that you explain this term in either English or Hindi. It is good for us to understand, to learn also. We are all students, no problem.
Yes, yes.
So many things to learn. Yeah, yeah.
Yes, sir. So any doubts regarding today's about the syllabus or anything about the material and course, about the course? Anyone have doubts?
Very nice description delivered by you. Thank you so much.
Thank you,
My
sir.
Macronutrients are carbohydrates and lipids and the protein.
And proteins.
Micronutrients are vitamins, minerals, and phytochemicals.
I will explain about phytochemicals
Okay,
later.
ma'am. Tomorrow.
And this carbohydrates part, the role is very huge. I will explain separately. Each and every role and how many grams and from where we are getting the important of carbohydrate, the metabolism of carbohydrate, everything I will explain. So
Oh,
this is just webinar, the first day class, na? So I have started with the macronutrients. So we are many things to learn.
yes.
In
Thank you.
that.
Thank you, ma'am. Thank you.
Thank you very
Uh,
much. Namaskar. Namaskar.
Excuse me,
Namaskar.
ma'am.
Thank you. Yeah, please.
Ma'am, Monali here. You said we need to refer few books. So would you mention the books in the group, please?
Definitely I will mention, but not now. So in the course, I will definitely I will mention, because if I share the links now, you will get confused.
Okay,
First,
okay.
ma'am have to talk about the basics now.
Basics, yeah.
Then everything. Then we'll
So-
go. But books.
So, yeah, books. So whenever I'm discussing about gut health, diabetes, and whenever I discussing about something else, definitely I will share the links. So, for example, if I'm explaining about RDA, I will share that particular PDF in the group on particular day, like that. You don't get confused if I share like that.
Tomorrow also same time, ma'am.
Same 8 to 9.
Okay, ma'am. Thank you.
Okay.
Yeah. Thank you.
Okay. Thank you, everyone.
Thank you, ma'am.
Yeah, for joining. Have a nice day. Bye. Let's meet tomorrow.
Thank
Yeah.
you.
Thank you.
Thank you. Bye, ma'am.
Thank you. Bye.